Good afternoon, and thank you for joining us today. This is our last scheduled press media conference for this year, and we have a lot of very important updates to get out to you today. As you know by now, the governor has extended the stay-at-home order as the virus is continuing to spread quickly through our community. I know this is frustrating for all of us, and we're tired of it, but we need to face reality about the spread and the impact of this pandemic. New Year's Eve is tomorrow, and there certainly will be a lot of temptation to go out and celebrate with friends. We want all 2020 to finally come to an end and to celebrate the new year. But if we don't change our practices, 2021 will bring the same misery as this year. If there was ever a time for a quiet New Year's Eve celebration at home, now is that time. Let me put it as simply as I possibly can. Going out to party on New Year's Eve during a global pandemic is putting your life at risk and the lives of your friends and families at risk. Is it really worth it? Please stay home. Now there are many things to leave the house for. One is to get tested. Testing will be available on New Year's Eve until 4 p.m. And on New Year's Day, 5 sites will be open from 10 a.m. to 5:30 p.m. Those sites will include the Tubman Chavez Center, Lemon Grove, USD, Imperial Beach, and Vista. Those sites will be open from 10 a.m. to 5:30 p.m. This information is on the screen now and certainly will be posted on our website, which is listed on the podium in front of me. We are also in the throes of our annual flu season. While we wait for our turn to get our COVID shots and vaccine, this is a good reminder and a good time to get your flu shot so as to not compound our situation any further and certainly preserve hospital beds. With that, we're going to move on. First, we're going to have Supervisor Nathan Fletcher, and then we're very honored today to have with us Dr. Christian Anderson from the Department of Immunology and Microbiology at the Scripps Research Institute, and he'll be followed by Dr. Eric McDonald to give us the medical update. Supervisor Fletcher.
Good afternoon. About an hour ago, the governor, in a joint appearance with Dr. Anthony Fauci, confirmed that a UK variant case had been detected in the state of California, and I can confirm that that case is in fact in a patient in San Diego County. A 30-year-old man with no travel history started developing COVID-related symptoms on the 27th. He was tested yesterday on the 29th around 10 a.m. The results came back in COVID positive around 5 p.m. Thanks to the incredible work of the Search Alliance and Dr. Christian Anderson, who you'll hear from in a minute, they were able to process that result and knew in the early morning hours this morning that this individual does in fact have the UK variant strain of COVID-19. Because there is no travel history, we believe this is not an isolated case in San Diego County, and there are probably other strains, other cases of the same strain in San Diego County. And while it's been pointed out that there is not yet evidence that the strain has any more severe symptoms, there is significant evidence that it does spread considerably faster, that it is much more contagious. And so because of this, along with the significant increases in cases we've been experiencing in San Diego County, the tremendous strain on our healthcare system, which we've been documenting and sharing with you for weeks, because of all of these factors, we continue to encourage the public and plead with the public to please come together, especially over the next 72 hours in the New Year's holiday, to please follow the public health orders. Please avoid the temptation to go about things as you normally would around this holiday season. We have to come together as a community, and we have to take decisive action to slow the spread in our communities. And so we continue again to ask and request out of a sake to save lives of those on a day we have one of our highest totals in number of deaths, to reduce the strain. We've talked at length about the tremendous burden being borne by our frontline healthcare workers and our ICUs, the number of cases, and out of a desire to get these cases under control so we can begin to resume aspects of our life. We continue to implore you. We have seen a number of entities that are advertising New Year's Eve parties, advertising they want to party like it's 1999, but it's not 1999, it is 2020. And in 2020, we face a global pandemic. And so we need everyone. It isn't every New Year's Eve forever, it's just this New Year's Eve. Please take this serious. Please understand the situation we face, and let's find a way to come together as a community. In a minute, you will hear from Dr. Christian Anderson at Scripps Research. It was his work that uncovered this strain. In San Diego County, we have an incredible search alliance, a combination of Scripps Research, UC San Diego, Rady Children's, and the County of San Diego, along with others who participate in examining and looking at these cases. And while it is a small number of the total positive cases that get examined in San Diego, we believe we have one of the most robust efforts of this kind in the country, and we're incredibly grateful to Dr. Anderson and his team and everything that they are doing. Before we head to him, one quick update. There have been a number of questions around issues of vaccine distribution and the sequencing of that and the process of that, and I just want to very quickly share with you that a lot of entities receive vaccines directly. From a county public health standpoint, our primary role is to try to serve as an air traffic controller and try and guide those, but a lot of entities are getting them. Health systems get them direct, Department of Defense gets them direct, CVS pharmacies get them direct. There are a number of entities that do this, and while we all, in the County of San Diego as well, and while we all work to administer and provide those vaccines consistent with the guidance that's been put out with the tiers and ranking type system, there is some work left to do to make sure we have a collaborative and coordinated region in terms of moving forward in this. There have been some reports of a system that had some that were nearing expiration, and they made the correct decision to not let them be wasted in administering those to individuals whose tier we were not yet at. But as we move forward, we are continuing to work, and our public health officer sent a notice to all of the healthcare systems about the incredible need for us to coordinate, so that if there is excess, if there are unused ones, if there are ones that are nearing expiration, that we can share them across systems and be collaborative to make sure that we hold fast and hold consistent to the tiering system that's been outlined of the order and sequencing in which we need to go. And we appreciate their cooperation and coordination in this very difficult area, and we will continue to share with you all of the information that we have as it relates to vaccine distribution processes. And then lastly, before we hear from Dr. Anderson, we know it's been a very difficult year on our businesses, particularly our small businesses. At the county, we've worked hard to provide tens of millions of dollars of grants and assistance and relief to those that have been impacted. And I just want to share that our efforts in partnership with the San Diego and Imperial SBDC Network and the San Diego Foundation has been working in a variety of programs. And we want to let you know that thanks to a program from the state of California administered by these entities, there's $500 million in grants that are now available to businesses that have been impacted from the COVID restrictions. Applications are now open. The deadline to apply is January 8th, 2021 at midnight. Grants are to cover business expenses for those hit hardest by the pandemic. To apply, you visit careliefgrant.com, careliefgrant.com, and you can follow the prompts on screen there to be eligible for the $500 million in grants that are designed to help us with our businesses here. With that, let me turn it over to Dr. Anderson, who's going to talk more about the UK variant's presence here in San Diego County. Then we'll go to Dr. McDonald, and then we'll get back to everyone's questions. Thank you.
Thank you, Supervisor. Which one's alive here?
Just talk.
Okay, thank you. Thank you, Supervisor, for inviting me here. And as Nathan just mentioned, we detected this UK variant. The name of it is B117, is how it's known. Detected in a patient, as the Supervisor mentioned, got a diagnostic test yesterday. On one of these S dropout, as it's called, we could see on the diagnostic test that this looked like this could be this lineage. We confirmed it at 3 a.m. this morning using sequencing that this is indeed the B117 UK lineage. Now, this is a collaboration, strong collaboration between the San Diego County here. There's a very strong surveillance program, genomic surveillance program in place to sequence from patients that come in the county here. It's a collaboration between Scripps Research, UCSD, as well as Rady Children, and many other partners here in San Diego. Now, we have detected this lineage, but we knew because of travel patterns and because of how prevalent it is in other parts of the world, we knew that this was also something we were going to find here in San Diego. It was only a question of when. We have now found that first case. Again, the case had no history of travel, so we know there's more. We don't know how many. We know that its prevalence for now is relatively low, because the other lineages that we see circulating are not of this particular UK lineage. And again, we're doing this consistently, so we have a good picture of this. What's really important is that detecting this lineage here doesn't really change what we need to do, other than we need to do it better. And the questions that we typically get around this is that, is it really transmitting better? In the UK, it is, and we know that it's because of the properties of this particular lineage. We should expect that the same is going to be true here in San Diego, but we don't yet know whether that really is going to be the case. But we need to prepare that this is probably what we're going to see in the following months coming up. So we need to continue the social distancing. We need to continue to wear the face mask to protect ourselves, to protect others as well. And we need to do it better. And we really need to do this very consistently. We often get questions around this. Might this infect, the way that we can diagnose patients? We don't think so. None of the diagnostics should be influenced by the fact that we have this lineage here. We got a lot of questions. Is this more severe? Is it less severe? The data out of the UK suggests that there's no difference, although the data is very early, so we don't yet know the answer to that. And the final question is that often is asked, could this affect the vaccines and pre-existing immunity for people that have recovered from infection? We are hopeful that it won't, but I will say that we just don't have the data yet. So this is unfortunately one of these times where we need to say that we just don't know. And speculation is not something I like to do. So I would just say that until we have the data, which I'm hopeful we'll have within the next couple of weeks, primarily from our colleagues in the United Kingdom, we will know more. And we will know the answer to these questions, but for now, we don't know the answers. So with that, I'll give it over to Eric next.
Thank you, Dr. Anderson. Again, just to briefly overview what we know about the case, this is a man in his 30s with no travel history who became symptomatic on the 27th, was tested yesterday, sequenced overnight to show that he had this UK variant B117. He's not hospitalized. Contact tracing is currently underway. Unfortunately, we do know that there is one household contact who became symptomatic yesterday and is actually being tested today. I want to begin also, or just continue with an update on our local COVID numbers. Cases have continued to linger between 2,000 and 3,000 over the last couple of weeks each day. These numbers are significantly higher than the case counts just 1 month ago. Today's case count is just over 152,000 cases, including the 2,448 new cases reported today. The age range of the cases is unchanged from previously, and the median age is also unchanged at 77. Our table lists here that 5,826 cases, or 4%, as having been hospitalized, but I want to point out this is based on initial case investigations only. And if people become hospitalized after an investigation, that may not necessarily be recorded here, and so I expect these numbers to be revised upwards. 1,213 cases have been hospitalized in the ICU, which is 1% of the total cases and 21% of those hospitalized. The total number of cases includes 1,472 deaths, representing 1% of the total number of cases, with 37 new deaths reported today. The new reported deaths range in age from 54 to 100, with 30 having known underlying medical conditions, and 7 are still pending investigation. And all of us at the county wish to express our condolences to the families and friends of these fatal cases. Unfortunately, we expect the number of deaths reported this week to top 100 based on the preliminary information we're getting from the hospitals. Next slide. In the past 7 days, we were reporting 55 total community outbreaks from December 23rd through the 29th. This represents a total of 240 cases and will be a stable number of community outbreaks that we've reported over the last couple of weeks. The next slide. There were 11 additional outbreaks reported from yesterday, which are in the following settings: 4 in business settings, 4 in daycare, preschool, or childcare settings, one in a food and beverage processing, one in a hotel resort spa, and one in a K through 12 school. As you're likely aware, community outbreaks and the total number of cases are ways to reflect the widespread transmission of COVID in the community. But there are other ways to do that. And I think that one of those ways is to look at our number of influenza cases that have been reported. We produce a weekly report on influenza that came out this morning. And unfortunately, after weeks of case counts that were in the single digits, the number of influenza cases reported last week jumped to 171. Indeed, there have also been a total of 14 cases of co-infection between influenza and COVID. And while the number of flu cases is low this year compared to this same point last year, about 1/10 of what we would see in a normal flu season to date, this week-to-week increase clearly shows that the environmental conditions are right. It's getting cooler in San Diego. People are spending more time indoors, and that people are doing what they do over the holidays, which is to gather, to be closer, to have more personal interactions. So it's another reinforcing reminder. Increasing influenza is paired with this increasing COVID, that we need to do the things that we've been told over and over, and I'm going to say them again, which is you need to maintain your distance from those who aren't in your household and stick to essential travel only outside your household. Wash your hands properly and regularly, or use hand sanitizer. Wear the mask, and stay home and isolate if you are sick. Get tested quickly so that we can determine whether you are a case and then can take appropriate precautions. These evidence-based strategies are our best defenses in countering the spread of both influenza and the virus that causes COVID-19. I would encourage anyone who has not had their flu vaccine so far to date, and that's about 2/3 of us here in San Diego, to do that now. You can get it. It's readily available in health systems, pharmacies, public health clinics across the county. If you don't know where to go, you can go to our website at sdiz.org, or you can call 211 San Diego. And you know, many of us, most of us, are waiting for our turn to get our COVID shot. Now is the perfect time to get your flu shot while you're coming up to your position to get your COVID shot, because you cannot get both at the same time. Next slide here. On December 6th, the regional stay-at-home order went into effect in Southern California because the ICU capacity dipped below 15%. This shows that the current status, both here and in San Joaquin Valley, is at 0%. It's been 3 weeks, just over 3 weeks, since that stay-at-home order was in effect. And while we've had sort of a stabilizing in the number of cases, it's clearly not getting better, and in fact may indeed get worse because of this holiday activity. So the state announced that we are extending the stay-at-home order for Southern California and implementing a 4-week projection model with a projection to be available on a daily basis. In other words, they're going to report daily the projected number of ICU beds that are available, and once that projection goes above 15%, the stay-at-home order could be lifted. And then the last slide, as we near another holiday, I want to remind everybody that each of our actions collectively matter. And this is a particularly vulnerable time. We've noted cases increase after vacations in the past, but we have 2 holidays in a row, Christmas followed by New Year's, and that is a potential amplifying event. To reinforce what Chairman Cox said, it is key that people stay at home. I do want to wish everyone a healthy and safe new year, and we expect 2021 to be much better than 2020, but it's not the time to let your guard down. It's really the time to double down on all those activities to be sure that you, your family, your neighbors, and the County of San Diego remain safe. And I'll turn it back over to Chairman Cox.
Thank you, Dr. McDonald. We've got a lot of questions that have been called in, so let's go ahead and take the first one.
This first call is from Alicia Summers with Channel 8. Please state your question.
Hi, yes, I have 2 questions. First, the CAP continuously stresses the dire situation we're in when it comes to ICU bed capacity. people are being triaged, others are waiting hours to get into the ICU. And now the UK variant is in San Diego. So my question is, why hasn't the county activated its emergency plan, MXD, mass casualty incident, or something of this nature? And so at what point are the county resources overwhelmed and need help? And then number two, why hasn't the county declared a state of emergency so that we can receive federal assistance from FEMA, who can set up pop-up hospitals, which will seemingly alleviate the ICU bed capacity problem?
Okay, Dr. McDonald's going to respond.
Well, I'm not quite sure what you mean by some of the questions that you asked. What I'll do is I'll say that we have an active healthcare capacity task force in San Diego with the leadership of the county and all the hospital systems and the EMS systems meeting on a regular basis to monitor closely the status of the county and to make appropriate adjustments in services to be sure that the demand is met. And that's meant a lot of activity inside hospital systems and between hospital systems to make sure that the burden is being shared. It's also changed, again, some of the pre-hospital algorithms that we cover, but the Healthcare Capacity Task Force feels that the current measures that have been instituted are appropriate for now into the near future. If that needs to change, that task force will make those moves.
Okay, got it. So we don't need to initiate or activate the emergency plan as of now. It's not that bad yet.
No, and just to add on to that, you asked about declaring a state of emergency. We did that 10 months ago. In February, we declared a state of emergency. And so we have been drawing down every possible resource we do. We're also in daily communication and coordination with all of our hospital systems. And we've had hospital CEOs, hospital system representatives here to talk about all of the things that they are doing to meet the need. We've had them talk about how they're delaying treatments. Example, cancer patients, tumor removals, those are being delayed to create ICU system capacity. They're delaying organ transplants. They've changed their staffing and how they're modifying it. They're taking a series of steps every single day designed to do everything we can to ensure the continuity of our healthcare system. And as has also been discussed, the state has outlined the crisis care situation. If you end up in that situation where you don't have enough, the appropriate steps that hospitals need to take. And so I think it is a daily effort to monitor and track and take appropriate steps. But we did declare a state of emergency in February, and we continue to do everything possible, working with the state to stand up federal medical centers, working with our hospitals to support them in everything they're doing. So everyone, I think, is acutely aware of how serious the situation is and is doing everything possible in our power to do it. And then the final point I would say is the best thing we can do to ensure hospital system capacity is slow the spread. As you look at that rising number of COVID cases that are taking our ICU capacity, our hospital capacity, it's shrinking the number of non-COVID patients, which means people that are not getting care. And so we have to slow the spread. And if we do that, we can slow the hospitalizations and we can get back in a better place.
Yeah, it seems like we are getting worse and worse. The numbers keep getting worse. We're really bad here. So at what point will FEMA be called to come in and set up pop-up hospitals so the ICU bed capacity could be larger?
Well, I think everyone is doing everything they can to slow the spread. And if you look around the surrounding counties, you look around surrounding states, San Diego is not on an island here as the only one experiencing significant strain on our healthcare system. And so I think everyone from our county system to our hospitals, to our state government, to CDC and the federal government, everyone is doing everything they can to ensure that the availability is there. But it's not just to have a pop-up hospital. You got to have a pop-up nurse. And we've talked for weeks on end about the significant challenges around staffing and the impact that this has had on healthcare systems. And so the strain that we're feeling is being felt across the country in many areas much more severely than it is here. And I think everyone is doing everything they possibly can to confront the situation. And again, to reemphasize, the best way to get us out of this is to slow the spread of COVID, and we need people to stay home.
I might just add, Supervisor Fletcher made reference to the fact that San Diego County declared a public health emergency on February 14th. I think we were one of the first counties in the United States to declare a public health emergency. Let's go on to the next question.
The next caller is Hunter Sowers with KUSI. Please go ahead.
Hi there. Yes. Hi. Thank you so much for taking these questions. I know that we have an overview of the tiered system in terms of the vaccinations and the state process of getting those out, but I'm hoping to get a little bit more clarity on where San Diego County fits exactly in that equation. Can we get an update on how many people have received those vaccines, which vaccines specifically people are getting? And also curious, I'm not sure if y'all have already started posting this, but a daily tally of those vaccinations so that we can kind of continue to follow, because I know a lot of people have questions on who's next and where they would receive it, that kind of thing. So if you could just provide some clarity on where exactly we are with that.
Okay, Supervisor Fletcher has that information.
Thank you. Thank you for the question. It's been top of mind for a lot of folks and certainly for everyone here at the county. I think the good news is we are talking about vaccine distribution, which is encouraging given the year that we've had across California and across the country. We still are in Tier 1 of Phase 1A, and that is working our way through, staff working in acute care and psychiatric hospitals, staff and residents in skilled nursing facilities, assisted living centers, and other similar settings for the older or medically vulnerable individuals, along with paramedics, EMTs, and others providing emergency medical services, and efforts that are underway to vaccinate folks who will be able to administer vaccinations as they come in significantly larger doses in the future. What I mentioned earlier in my comments, I think, is very relevant to right now, which is it is a somewhat fragmented type system, and that a lot of entities get the vaccine shipments directly. And so we are working to try and get a better sense of exactly how many have been received. We also have the San Diego Immunization Registry, where as individuals are given a vaccination, then we should have a greater clarity or insight, but there is a little bit of a delay and a lag in terms of updating that. In our most recent COVID watch, we did provide the information that we had, but again, there is a little bit of a lag and delay. And we're hoping in the coming week or so to be able to unveil a vaccination dashboard to track how many are coming into the county and how many have been administered. But again, because it is a fragmented system, as a county, we end up playing a role of air traffic controller, of trying to collate this information and bring it together and make it available. And all of those efforts will continue. But we do remain in Tier 1 of Phase 1A, which is the highest level of individuals in our healthcare systems.
When the vaccination dashboard is launched and we are able to see kind of more of what the big picture looks like as far as our hospitals, will it be up to each hospital to record that when people are able to start getting them outside of, those frontline workers beyond the Tier 1? Will it be free? Where would people go to get it? Have we started kind of putting those plans in place yet?
Well, we'll share what's in the dashboard when we release the dashboard. But I think that look, we're a ways away from vaccinations available for the general public. We have a number of tiers that we have to get through before we get between here and there. But it is our hope that folks will be willing to receive the vaccine. We know that there will be work and effort that has to be done around that, around education and communication and building in confidence. We also have an incredible clinical advisory group that is guiding the efforts countywide around vaccines, and then community individuals who are involved in the process as well. And so we will continue to be very transparent with the information we have, the data we have, along with sharing when it is appropriate for folks to get it, how they can most easily access that vaccine.
Okay, we'll go to the next call.
This next call is from Amber Frias with NBC7. Please go ahead.
Hi, thank you. My question has actually been answered, so I appreciate the time.
Thank you.
The next person is Alexandra Meek with CNN. Please go ahead.
Hey there. Thank you for taking my question. With the UK variant detected in San Diego, Dr. Anderson, you mentioned that detecting the lineage doesn't necessarily change what needs to be done as far as the need to social distance and whatnot. But I'm just wondering, with the more data on the lineage not expected within weeks, until then, how do you expect that this new strain could possibly affect those who were immunized previously or those who may have already received the vaccine?
Okay, Dr. Anderson is going to respond.
Thank you. Yeah, thank you for that question. So as I mentioned, we just don't have the data yet, so we really don't know. And I think it's important that we don't try to speculate here. We are hopeful that this particular lineage will not have any effect or minimal effect on pre-existing immunity, whether that being from previous infection or whether that be from the vaccination. But it's really important here that we need to wait for the data. And the data is going to be here soon, hopefully, from the UK colleagues first. So we're hopeful within the next week or two we'll know more about this. But until then, we're hopeful that it won't affect it, but we just don't know.
Got it. Thank you.
Okay, we'll go to the next question.
The next call is from Brandon Lewis with Channel 8.
Thank you. My question is also for Dr. Anderson, and I'm wondering, I know there's a lot of focus on the UK strain, wondering if there's any evidence of the South African strain of coronavirus, and can you also explain a little bit about how coronavirus mutates and perhaps things you're monitoring about other potential mutations off of the UK strain, maybe even within our own borders?
Okay, Dr. Anderson.
Yeah, thank you. So to answer the first question about the South African variant, so it has, South African lineage, it has one of the same mutations as the UK variant. It's called N501Y. Now, we have been looking for that as well via these sequencing programs with the county and have not found evidence of it yet. What's important here, though, is that the reason why we could detect the UK lineage yesterday was because of this S dropout, which is a little quirk in the diagnostic test that gets done, which we can't do for the South African lineage. So we will have to wait until more sequencing has been done. Now, coronaviruses mutate all the time. So we have seen many mutations previously, and this is just that continuation on that. What is important here is that especially the UK lineage has a number of additional mutations that are outside what we have seen previously, and that's also why they have suspected that this might have come from a chronic infection that gave the virus a chance to evolve in a different environment than what we would typically see. So again, the mutations happen all the time, but what we have observed, especially for the UK lineage here, is somewhat unusual, and that's why we need to do all this additional experiments, get all this data on how this might actually affect the virus. Because again, mutations happen all the time and typically would not change the virus. This is the first time, or say the second time, we'll see something that may, and specifically might make it more transmissible.
Thank you, Doctor.
Okay, our next question.
This next call is from Jennifer Kastner with ABC 10 News.
Hi, good afternoon. Supervisor Fletcher touched on this earlier, but I'd like to come back to it. Yesterday, the county confirmed that Sharp Healthcare had hundreds of vaccines that were set to expire Monday night after hours, so they administered them to Phase 1B police officers without directive from the county, which would have directed the hospital network to find 1A recipients instead. And since then, there have been allegations that other non-1A recipients have gotten the vaccine from Sharp, including executive staff and even personal trainers. What can the county confirm, and how is it that a hospital network could not have foreseen having such a significant surplus of inventory that was set to expire? Does the county monitor providers' daily vaccination counts?
Okay, Supervisor Fletcher.
Thank you for the question. I'd refer you to Sharp Healthcare for specifics on the situation they encountered. But in general, what we're trying to do, and the notice that was sent out to all of the hospital partners from our public health officer was just that, to ensure that there is coordination, that if there are excess dosages, if there are ones that are nearing expiration because they've been removed from the deep freeze and they can only stay out of that for so long, that we ensure that there is coordination and collaboration, because there could be another entity that has Tier 1A individuals who might be ready to receive the vaccine and they didn't have enough. And so again, it is a fairly disjointed system. We have a lot of entities, again, that get them direct. DoD gets them direct, CVS gets them direct, hospitals get them direct, and we are working as best we can to pull together regional coordination and collaboration. And we do believe it is important that as best as humanly possible, we do everything we can to adhere to the tiering system and work through that in an equitable and fair way. And so we're going to continue to do everything we can to ensure ongoing cooperation and coordination and adherence as best we can to that. And then again, I would refer you to Sharp for any questions about their situation. Thank you.
Thanks.
Okay, we have one final call-in question.
This call is from Paul Sisson with the San Diego Union Tribune.
Thank you. I guess first I wonder if anybody could say a little more about this dropout that was seen in this 30-year-old patient's test that gave a clue that this B117 strain may be involved. How does this pop out of a normal PCR test and give you a clue that you can then follow up with genetic testing?
Okay, Dr. Anderson's going to respond.
Thank you. Yes, so that's a good question, and it comes down to the diagnostic assay here, which is being used, which is the thermo-TAC-path assay, which is one of the assays that are being used here in San Diego. Specifically, this is at the Excite lab at UCSD, but there are others being used. And the reason why I call this the dropout is that this particular assay tests for 3 different targets in the coronavirus. One is called ORF1, one is called N, and one is called S. Now, this UK lineage specifically has a deletion, although that deletion is also found in other lineages, but is found in this UK lineage. It's a little deletion in the genome of this virus, which means that one of these 3 targets that we detect in the assay drops out. So it shows like that target is not there, while the other 2 will show up. So that means that it gets called as a positive sample because 2 of these targets come up positive. But then you have this 3rd target which does not come out positive and is therefore 0. So it has this very unique signature where, again, 2 of 3 will be positive on that very same sample, but one of them will be negative. And that's what we call the S dropout, because it's specifically this target that targets the S gene of the coronavirus, which drops out of this. So then once we have that, that is a suspected UK lineage, and we can then follow up with sequencing and specifically sequence that sample and then confirm whether it is indeed the UK lineage or not.
Thank you very much. That's great. And then I wonder if we can say how many close contacts this first B117 patient has, as contact tracers have surely interviewed this person by now if they're not in the hospital. Can somebody with public health maybe talk about how many people they've been in contact with, and also, are they known to have had any type of social activity previous to coming back positive?
Yeah, I'll answer that question. Thanks, Paul. We do know of 2 household contacts, and as I mentioned earlier, one of those individuals became symptomatic yesterday and is being tested along with the asymptomatic individual in that household are being tested today, and they're all obviously quarantined or isolated depending on which is applicable. Actually, this individual really had very few other social interactions during the potential contagious period 2 days before symptoms began, so that's good news. And then going back 2 weeks, the number of activities was also fairly limited. There was no work activity, and there was no specific gathering activity that we've talked about being the potential for a community outbreak. And so actually that, I think, is a strong indicator that this individual, giving a very good history to us, that the number of interactions in the 2 weeks before coming down with illness was actually fairly low. That there is probably there are other cases in San Diego that we just need to be aware of, which is, again, goes back to the take-home message that individuals need to be doubling down on their non-pharmacologic interventions that I went over in my portion of the press conference.
Thank you, Dr. McDonald. And I wonder, do these patients with this strain present any differently than the normal strains that are in wide circulation? Do they have slightly different symptoms that people might watch out for?
Actually, no. These patients will present the same way, or in fact, potentially be asymptomatic. And as you heard Dr. Anderson talk about, there will be tests that may just be positive, and it may just stop there. It's only because this system was in place, clinicians were looking for this dropout effect in this particular type of case, regardless of travel history. And then having it sequenced so quickly, really within 24 hours of detection, I think is astounding, and really a worldwide, benchmark to be here in front of you telling you about this positive case. And really the only way to tell is to do this kind of deep testing, which we can do in selected cases and will continue to do to see what viruses circulate here in San Diego.
Okay, that completes our phone-in questions. We have a number of texted questions now. The first one is dealing with, since this new variant is here, is there going to be any change in enforcement? And Supervisor Fletcher is going to respond to that.
And there's a two-part question from Laura Acevedo with ABC 10 News. She asks, with the UK variant now in San Diego County, are you considering any more serious enforcement to keep this more contagious variant from spreading before it gets out of control?
Yeah, we're doing everything we can on enforcement. We've got enforcement teams that go out, they inspect, they issue closure notices, they issue cease and desist notices. They're paired with law enforcement. They can issue citations, working with the district attorney's office, with the city attorney's office. We've requested additional help from the state with alcohol beverage control inspections. But there are limits to what you can do. And that is where we need the public to really understand the serious situation we face. And look, it is much more challenging. We're in an environment where other elected leaders go out and say this isn't real and you need to ignore it and you should defy it and you should not follow it, and there's so much misinformation. It is a very challenging time, which is why every day we go out and we do everything that we can to try and put in place not just enforcement systems and public health orders and messaging, but everything to try and break through of how serious the situation is and the steps that we must all take and the decisions that a widespread number of San Diegans need to make. And in particular, as we head into New Year's Eve. We saw what Thanksgiving did to us as a region. We don't yet know what the impact of Christmas will be. We cannot afford to have another holiday of large gatherings in unsafe settings. And we know that the really significant negative impacts that would have. And so we will do everything we can on enforcement, and we're asking San Diegans to do everything they can in their power to help us get through this.
And Supervisor Fletcher, the second part of her question was, how concerned are you about how this variant could impact our ICU capacity?
Well, look, it's not helpful. I mean, it is a variant and a strain that certainly all data indicates is significantly more contagious, which means that it could spread much faster. And so it only complicates the efforts around what we're doing. And, we hope that this understanding that it is here in San Diego really underscores the significance of what we have been asking and continue to ask everyone to do. Wear the face covering. Avoid close contact with people you don't live with. Avoid large indoor settings. Don't leave your home unless it's essential, unless you need to do it. Those are the things that you do to avoid every strain of coronavirus. And that's what we need everyone to really do, particularly over the course of the next month, which is going to be our most perilous time.
And Supervisor Fletcher, several reporters have asked about enforcement and preparation for New Year's Eve tomorrow. So I'll read this question from Heather Hope. She's asking, what are the steps the county is taking for enforcement for New Year's Eve? Is there anything specific? And what is the message for gatherings to close out 2020?
Yeah, the message for gatherings is really simple. Don't have them. Don't have them. Look at what is happening across San Diego County and look at what's happening across the country. And just recognize it's giving up one holiday celebration so that we can have more people around for future celebrations. As it relates to enforcement, we will continue with what we are doing. We will have an increased awareness of the concern around New Year's Eve type parties. And again, we have asked the state for additional help with alcohol beverage control for things that they may be able to do to help us with enforcement. I do want to invite Dr. Anderson back up to also add any thoughts he has around questions around the strain and what it might mean for San Diego. Dr. Anderson?
Yeah, I just wanted to add a couple of comments too, because when we're talking about increased transmissibility, what does it really mean? And this is quite important because, again, we've said that it doesn't change what we need to do, but it means that we need to do it better. The reason why I'm saying this is that when we see these epidemics growing here, there's a very central entity here which is called the reproduction number of how fast is it growing. When we see these surges here in San Diego and other places, typically this reproduction number is 1.2 or so. Importantly, once this gets to 1, that's when the epidemic will essentially stop and will no longer grow. And once it gets below 1, then is when it's starting to subside and we see the cases going down. What's really important here is that, again, when these are increasing, we see this number being about 1.2. When we then have shut down bars, restaurant, indoor dining, the various different things that we do, means that this reproduction number goes to about 0.8, 0.7 or so. So it's slightly lower, but what's important here is that it's below 1. When we're now talking about, and again, below 1 means that the cases will continue to go down. The problem is that when we're talking about increased transmissibility, potentially what we're talking about is that while this normally, under whatever consideration would be with the normal variant, the normal version of the coronavirus here, would be 0.8. If it increases by 50%, it means that it's not 1.2, which means that under normal circumstances where cases would start to go down, we might continue to see cases continue to go up. So that's why it's so important that when we're talking about these new variants, we're talking about potential increased transmissibility, is that the things we do, wearing face masks, social distance, working from home if we can, like all these different things, we need to do it better because it may be harder to get this reproduction number below 1. Importantly, it doesn't mean we can't do it because the things that work for the normal version of coronavirus is also going to work for this particular version of the coronavirus. It's still the same virus. It's not different in that. It's just that this new lineage here may be transmitting a little better. So that's why we really need to double down on these various different measures we can all do to stop the transmission. And whether it's the variant or whether it's the one that's been around all along, it doesn't make a difference. We need to continue to do it. We just need to do it better.
Thank you, Dr. Anderson. This next question is dealing with the availability now of vaccine. There's going to be some cross-training going on with fire department personnel, and I believe Supervisor Fletcher is going to respond to that, and Nick Mascione may have some additional comments.
So this question is from Claudia Buccio with Univision. Can you talk about the county's partnership with fire departments to train paramedics so they can help administer vaccines to others once they are vaccinated?
Yeah, this is a unique partnership, and we're grateful for the city of San Diego and other cities that we believe will join in to develop a partnership around paramedics as we expect to receive significantly larger numbers of dosages. We want to make sure that we have people on hand who can administer those vaccines. And a lot of the folks that traditionally would do it are incredibly busy. Our nurses, our doctors are very taxed treating COVID. And so to have the paramedics step up and say, look, we are willing and able to work extra and do more and be able to go out and administer vaccines, we think will provide a ready workforce of individuals that as we start seeing more significant dosages of vaccines arrive, can be on hand to help us administer those, again, following the sequencing in tiers. And so we're grateful, again, for the city of San Diego, for their fire department being willing to step up and say, hey, put our paramedics to work as healthcare workers helping administer these vaccines. And we look forward to partnerships with other cities in the same type effort.
Just to add to Supervisor Fletcher's point, absolutely. We want to tap into the 2,400 paramedics that we have in this county, and that's only going to happen through the collaborative relationship we have with all the city fire departments, including CAL FIRE. Point out that the work that we've done also with CAL FIRE on testing and then also flu vaccinations is now natural, working with them in the unincorporated area, and now obviously working in great partnership with the San Diego City Fire. Also the work that we've done in Chula Vista on testing with their fire department and their crew at the Chula Vista Library for testing. So we're very fortunate in this collaborative relationship we have with county and cities And this, in fact, is the vaccinators, activating that workforce that will then enable us to open up more vaccination sites in cities and throughout the county.
And the next question is from Bill Feather with NBC7, and I believe you can also address this. There's concern from individuals who are not directly associated with a medical facility, but are in private practice as an independent contractor regarding equal access to the vaccine. So the question is, can you address how the vaccine will be provided to independent healthcare workers and how they will be notified?
As Supervisor Fletcher mentioned earlier, we're still in Tier 1 Phase A, 1A. The very independent physician practices medical groups are in the next tier within Phase 1A. And there's great work already being planned by our county clinical advisory group. In fact, this evening, there's a clinical town hall among the physicians to talk about that. Clearly, those medical groups and those physician practices that are associated with a vaccine administrating organization, i.e. a hospital, they're going to be taken care of. But as has been noted in the question, there's others that are not. And that's where we, the county, are stepping in, setting up these vaccination sites throughout the county. That's kind of why we're working right now in the first tier with the paramedics and our nurses, increasing that workforce, making it available so that as we move into now the next tiers, we have the infrastructure and the vaccinators to take care of physicians, for example, in these group practices.
And there's actually a follow-up question regarding to these tiers. This is from Kim Miller with ABC 10. Did any fire departments in the county receive the vaccine directly, and is there any situation that would permit a department to be vaccinated prior to the scheduled phase?
There's a mechanism we have that fire departments, in fact, can register with the state, as well as go through some training, and with the appropriate type of storage and security, can in fact receive vaccine. And we are having that conversation with, in fact, one fire department. As it works now, the county receives the vaccine, and we are providing that vaccine to all of our partner cities through the efforts we're doing with the paramedics. The second part of that question was?
I'm sorry, I'll have to go back to it. The second part was, is there any situation that would permit a department to be vaccinated prior to the scheduled phase?
Well, the paramedics, when we're talking about fire, the priority now is vaccinate the vaccinators. So they are in Tier 1. It's a high priority group, and that is the very workforce we're trying to vaccinate so we can train, and they in turn can then vaccinate others. So they are a priority, and in fact, last week, on Tuesday of last week, we vaccinated 125 paramedics. So we have been vaccinating now every day, and again, using some of our partners to help prioritize a very important group with the paramedics.
Thank you.
This next question deals with our ICU bed capacity, and Rob Sills, our Chief Medical Facilities Director, is going to respond.
This question is from Carlo Cicchetto with Channel News 8. Could you walk us through how the Southern California region gets to 0% ICU capacity when San Diego consistently has capacity in high teens or low 20s?
Yes, this has to do with the state's calculation. And for the exact formula, I would refer you to the state's website on that. But we are just one county of 11 in the southern region. So whereas our numbers, are looking in San Diego, it's not indicative of all 11 in the southern region. But for the specific formula and what's included and what's not included, definitely refer you back to the state's website that has all that information.
Thank you, Rob.
This next question deals with the reference that Supervisor Fletcher had to the $500 million funds that's available through the state of California for business assistance, and Supervisor Fletcher will respond.
Okay, this question is the $500 million state grant funding for small businesses expected to help decrease the unemployment rate? And can the businesses spend the money as they see fit, and how soon could they see the money? This question is from Kelsey with Fox 5.
Yeah, the $500 million fund is designed to alleviate the negative impacts of COVID, to try and provide some help and relief to businesses, to be able to give them not a loan but a grant, particularly those that have been impacted. The application deadline goes through January 8th, and so businesses need to get in their applications at that point, and then they will be reviewed, and then the funds will hopefully be distributed very quickly. But whether it was the county's funds that we did, our small business economic assistance, where we gave grants to businesses that applied, whether it's this, the federal government is coming back online with PPP. All of these programs are designed to recognize the very real negative impacts that COVID-19 has had on our small businesses. And the efforts that are designed to not make the situation worse certainly are hurting particularly our restaurants and those entities that have some of the most severe restrictions. So all of these programs, the federal program, which is coming back, thankfully, the state program, the county programs, nonprofit programs, things that the SDBC and the San Diego Foundation, others, all of these are designed to give a little bit of help and support, a little bit of a lifeline to businesses to try and get them through this difficult time.
And our last texted question this afternoon deals with the fact that obviously with this new variation of the coronavirus, what sort of communication is going back and forth between the United States or San Diego and Tijuana and Mexico? And Dr. McDonald is going to respond.
This question is from Nelly Cervantes with El Imparcial. Being that we're a binational region, I'm wondering if the information is flowing both ways with Baja health officials on this new variant. Any news if there's any cases on the new variant on the Mexican side?
Yeah, thanks for that question. Just gives us an opportunity to say that we value our collaborative working relationship with all of our partners in Baja California and in Tijuana in particular. We do know that case counts are going up there. We know from our own testing at the border that the percentage of positive cases has increased so that for the last 3 weeks, it's about 1 out of every 4 cases are positive for individuals who voluntarily come and get tested at the border. We give all of that information on those cases and actually our daily status updates to our colleagues in Baja California. We're making this general announcement today about this variant, and we will follow this up with ongoing conversations with our colleagues in Mexico. It is my understanding that this variant has not been detected in Mexico at this time, but because it's been detected now here and in Colorado and is likely to be detected elsewhere, I think it's just unfortunately a matter of time.
Thank you, Dr.
I'm sorry, Dr. Anderson has a quick follow-up to that too.
Yeah, let me just quickly follow up on that because we also have very extensive collaborations with colleagues across the border in Tijuana and other places and have sequenced from there. So far, we have not detected this particular variant in any of those sequencing. However, that sequencing only runs up to the month of November, so it's possible, probably likely, that there's also evidence of the variant there, but we, so far, on the sequences we have done from Baja California, have not detected this particular lineage yet.
Yeah, I'm glad you mentioned that, Dr. Anderson, because again, one of the things that we do know that really emphasizes the binational quality of our community is that in the past we have essentially seen the same viruses circulating in southern San Diego and Tijuana. So really, it does emphasize the need for, and in fact, our follow-through with close collaboration with our colleagues in Mexico.
Thank you, Drs. McDonald and Anderson. That concludes our call-in and text questions for the day. We do plan to be back with you next Wednesday, but I would like to just take a moment, if you will indulge me, to thank Supervisor Greg Cox. This is Supervisor Greg Cox's last COVID briefing as he completes his term of service as a county supervisor in San Diego County, a term that has spanned decades and really represents a lifetime of commitment to public service and to the people of San Diego County. I suspect everyone has spent 2020 in ways they did not anticipate, but Supervisor Cox, when called on as chair of the board to lead the effort and to every single day work on the very difficult and very challenging issues of COVID, has shown up every single day with grace, with compassion, with a deep understanding of the severity and impact and significance of the actions that we're taking. And I am incredibly grateful to Supervisor Greg Cox, not just for his work this year and leadership surrounding COVID, but for an entire lifetime that has been spent serving the public. He has made a significant positive impact on our region. He's someone I'm proud to count as a friend and mentor, and someone we will dearly miss at the County of San Diego. And so I'd like to welcome back up for his final time as briefing to close us out, Chairman Greg Cox.
Wow, what a way to end. Well, thank you all for participating. And as it was mentioned, this is my last opportunity to make a few personal comments. And if you'll bear with me for just a few moments. Over this past year, I've been honored, obviously, to serve as chairman of the San Diego County Board of Supervisors. And I sincerely thank Supervisor Fletcher and all of my colleagues for their confidence in me and allowing me to hold that position. Also, with that position, it's been an honor to work with Supervisor Fletcher as the COVID-19 subcommittee for the Board of Supervisors. And it's been an honor to work with Nathan, and what a tremendous reservoir of information he has. And he's the great communicator for the County of San Diego. But also, I want to acknowledge that behind the scenes, there are certainly an army of dedicated county employees who have worked day and night in regards to responding to this COVID-19 pandemic. And a lot of it's been behind the scenes, obviously putting on these productions once a week now. When we started off, it was 7 days a week, but it's been a real team effort. And our medical team has been outstanding. I don't know that you could ever find a better team of medical professionals in any county in the United States. And I specifically want to recognize Dr. Wilma Wooten. It was really gratifying to see, and unfortunately she's not here today. She's getting the day off finally after a lot of time she spent over the last 9 months. But I wanted to congratulate her on being named the Union Tribune 2020 San Diegan of the Year. That's quite an honor for any individual and for a medical professional. I think it's a true tribute to Dr. Wooten and her team. But she has not only been tireless and unrelenting in what she has been doing in the face of this tragedy, but she has absolutely had a great team of other medical professionals that she's been working with. My thanks go out not only to her, but our entire medical team, including Dr. Eric McDonald, Dr. Nikki Fantides, Dr. Hernandez, Dr. Koenig, Dr. Bergman, and Dr. Foster. We've had great leadership from the top down, working to ensure that our hospitals are well supplied and our testing and contact tracing teams have been very, very robust. Let me thank our Chief Administrative Officer, Helen Robbins-Meyer, our County Counsel, Tom Montgomery, and our T3 czar, Nick Mascione, for the great job that they've done and the supporting roles that have come with Rob Sills, Jeff Toney, Jack Pellegrino, Hannah Feldman, and many others, including my Chief of Staff, Danny Melgoza, and Luis Monteagudo, and my entire team from District 1 at the County Administration Center. And our communications team. They're behind the scenes, pulling all the levers and making sure that these productions are possible. I wanted to take an opportunity to thank them for their great presence and great job. So thanks to Mike, to Tegan, to Tammy, to Suzanne, to James, to Andy, to Dominic, to Yvette, to Katie, Michelle, Leslie, Anita, and Tim. As you can tell, it takes a lot of people to put these productions together, and they have done an outstanding job throughout these past almost 10 months now. Our entire county workforce has been active in this response. Many county employees have taken on new duties and responsibilities to fight this pandemic, and many more have adjusted to new realities to continue providing services to our residents throughout the county. Our work will continue, and our region will remain in good hands as the county transitions to new leadership this next week. Finally, I want to thank you, the citizens of San Diego County. I know that some of you haven't always agreed with the decisions we've made, but I want to thank those San Diegans who, through acts both large and small, have worked to keep our region safe. Whether it's organizing food drives or simply checking in on an elderly neighbor, you have rallied in the face of what has certainly been the greatest challenge of our lives. Don't stop. Keep up the great work that you're doing. Keep up the fight. Please continue to watch out for your fellow San Diegans. And with that, let me say, God bless you. Stay safe. Have a very happy new year, and let's hope 2021 is a much better year than 2020. But also remember to do those things we've been asking you to do all along. Wearing your facial coverings, maintaining social distancing, avoiding large crowds, and have a very enjoyable, happy New Year, but stay at home and watch a movie or do something at home. Anyway, thank you very much. The entire team will be back here next Wednesday at 2:30 for the next briefing. Thank you.